got to accept that.
An ECT protest outside of NICE, the National Institute for, it used to be Clinical Excellence, but they changed it. They changed it to Health and Care.
I'm outside of the NICE headquarters with some people from Speak Out Against Psychiatry, doing a small protest here about, in particular, electroconvulsive therapy, where the NICE people, but not NICE, but the people from the NICE have essentially agreed that, if I'm not mistaken in this, they've actually issued guidance saying that electroconvulsive therapy can be used and can be forced against the directive of individual patients, and describe some circumstances within which that can happen. So that we're outside here discussing this. Just to put this in a bit of context, I actually recall reading in a newspaper in hospital a majority. This was a newspaper article, I think it was in the Guardian newspaper, and it was citing the Care Quality Commission, the body which regulates the hospitals. It said the majority of psychiatric hospitals do not reach basic human rights. So basic human rights standards could be access to contacting people, letting them know you're in the hospital, friends and family, regularly and so on. It can very basic things, including have they even done what they're supposed to do, the right paperwork and so on, before they force drugs on people, which is something I believe that shouldn't happen anyway. And so if we're in the context of hospitals not reaching basic human rights standards, I don't think we should be throwing fuel on the fire by saying, therefore you can have this brain damaging treatment, ECT, that's being prescribed to patients, being forced on patients. It's bound to be abused, even as I said, and it shouldn't be happening anyway. It is a violent practice. It doesn't matter if someone's underneath. It doesn't make it any better to subject someone to violence if they are under anaesthetic. That is, I mean, it's kind of a sick mentality. Well, we're just going to put someone to sleep, and then I don't know. You wouldn't accept that if it was to beat someone up, or to where they're unconscious and unable to do anything about it. You wouldn't accept that if it was to, I don't know, cut off a perfectly healthy normal limb. But for some reason, the NICE visual guidance saying, well, we should accept that if we should accept that with ECT, electroconvulsive therapy, and you know that's pretty appalling, I think. Not lack of funding, which is a problem with psychiatry in the UK, or it's model itself. They're really well-funded psychiatric institutions in other parts of the world, where all they do is, intern people. Like France locks up, I think, the majority of people with autism, basically, blanket internment. There's, and I don't think they move towards deinstitutionalization of care in the community. So the problem is not that that there's lack of funding for a sort of thing that is actually doing harm. We don't want to fund more brain damaging treatments. We don't want to fund people being subjected to violence, restrained in the prone position and having drugs forced into their body. We don't want any of those things. What we do want, there are all kinds of other things we could talk about. We talking therapies among them, social care. For example, is mentally ill and homeless. They're not going to find the means to get off the streets by themselves. For example, they're going to need something appropriate to help them. But unfortunately, all that's on offer for people like that is, it's not the case all the time. But but sometimes it can be, internment and drugs, and so on. But essentially, those people shouldn't be homeless in the first place in a country like Britain, which has, I think, a quarter of a million homes have been empty for 6 months. So you should just be able to meet their needs anyway. So it's not their fault. It's not they're not working hard enough. And it's and plenty of people. It's an extreme example, but there are plenty of people throughout society who it's not their fault. They're in their social circumstances, and talking in particular about mental illness, some of these people should have at least a base standard of living, as a kind of prerequisite to kind of fix these issues. So there are lots of things we can do which don't involve imprisoning people, anaesthetising and electrocuting people, which don't involve forcing drugs to in people's bodies when they're wide awake. We can move towards those other things. It's not, and for like you can have as much sincerity as you want for psychiatry. That's my view.
Depression leaflet, I think, the guidance we're doing at the moment.
We are, yes.
So that's what we're concerned about, really, because we really would like ECT banned rather
yes,
than...
I know. Yeah.
Just wondering, are there anyone on the committee that are into having ECT banned or not?
Well, I don't know what the individual views of members are on ECT. It's something we would specifically inquire about, so I don't know the answer to that question.
And I'm wondering in the guidance, it should, maybe it's a bit wishy, I was looking at it's a bit wishy-washy. I've lost it now, I had it in my hand a minute ago.
Oh, right, so I'll put it on my back. Have you've heard that ECT, and a lot of people that have ECT end up with brain damage and their lives are basically destroyed because it destroys the memory, whereby a lot of people that develop memory problems might remember things from the past, they've just got no short-term memory. With ECT, it seems it destroys memory of the past.
Yeah.
And even people that have acquired professional skills, they just sort of disappear.
Yeah.
And they end up being sort of unemployable. So their lives alter drastically. They've got no memory of the past. Their abilities have been erased.
And affecting and actually complicating their mental state for the rest of their lives.
Yeah.
The ECT given to young people destroy their lives.
Well, yeah.
And my son was given at the age of 17. It got worse. And then what happens in the system, once this happens, any complication, they are attributed to the person's mental illness, whereas the person is being, in the first place, brain already badly affected. And what happens as a result, they're given more medications which complicate further and then lead to very serious illnesses and, the person's health destruction. So is there any kind of intention of doing anything about that to improve people's life, actually people's life, quality of life, and giving them hope instead of just doing this, causing this harm? Is there awareness at all within NICE of this, what we're talking about?
Well, Because we know that there are many patients who benefit from it. So
You
it's not-
know,
It's
but-
also only short term, the
So-
benefit.
So
It could be very
like
short
with,
term.
like with many treatments, there are adverse effects.
This is bad.
But what
brain,
about-
And they don't tell you about the brain
But
damage.
just to
though,
give you an
do they?
opportunity to respond to what you
Yeah.
said. So when you, in an organisation like NICE works, you use the evidence, and the evidence is what comes out of clinical studies. It's also the evidence of people who have used the treatment or want to use the treatment. So it's not just a question of listening to doctors talk about it. We take into account all sorts of information. So that's why that guidance, our existing guidance, is really very carefully worded.
No, it is not. It's
about-
carefully worded, but it's
about
not carefully
understanding the
applicable.
adverse effects. It's about getting consent.
No.
People
it's about
can be
making
given
sure
it
that-
against
No,
their will.
my son was not given
No,
his
but
consent, but
I'm-
my consent was not. He was underage, and I was actually very much objecting to that, and I was told
Well-
he must have it.
This is, your experience, clearly completely unsatisfactory. Your
Very.
personal and your
Has-
son's
as many,
experience.
many other
It's
people.
essential that
Yeah.
you make that clear to the people who are responsible for his treatment. The guidance that we produce is very clear about the circumstances, the clinical conditions in which ECT should be considered. It's very clear about the importance of consent. It's very clear about ensuring the patient's aware of the potential adverse effects.
Does it
before
mention the
treatment's given.
adverse effects though? I think you should list
does.
the adverse
It
effects.
does. It talks about cognitive impairment.
But not much. And then
Yeah.
I think it
Well-
should list the cognitive tests. I think they should list the cognitive tests that should be done. Because at the moment they're just doing the silly MMRI or something.
Yeah.
It's just that test, which is only for dementia. It's not actually for the cognitive defects you get from ECT. So
Well, that's a-
really,
that's a
that should all be put in the guidance.
I mean, that's a
you know?
reasonable point. I
And,
think in
and to
general-
tell people there is brain damage as well.
It
That should
needs
be
to
put.
be, yeah.
That should be put in because people
Needs
aren't
to be.
told that. They're told
Yeah.
it doesn't cause brain damage, which is wrong.
Well,
And people only find out later on. Like we have a friend of ours, Dr. Sue Cunliffe, and she was a doctor. And then when they gave it to her, she was so brain damaged she couldn't even read, and it's taken her years to learn to read again. She can no longer work. She can't recognise faces anymore. You know.
And she was telling the doctor, she was telling the staff,
Yeah, at the time.
she didn't feel right. She didn't want it, and they carried on.
And they carry it's written in her
you know
notes
what-
and everything. It's
but this
just
is,
so
in a
bad.
sense, this is not about ECT. in
It
your
is.
case.
Well, it
This
is
your-
about
No, it's not about. It's not about the procedure.
Should
it's
we be
about-
doing
Yes,
brain
it
damage?
is.
It's
what
about,
about preventive?
it's
Should
about-
we be
really?
giving
It's
brain
about-
damage to people?
It's
Yeah.
about consent.
And it's
if-
about
And if in the
preventing.
case that you're quoting, a patient was treated without consent,
And there are
that's
many.
nothing to do with the guidelines. That's to do with the interaction and responsibility of the individual.
But you
clinician's
know,
consent.
let
what
me-
we shouldn't do is to completely remove the
The-
opportunity to have treatment from those patients who want it and can benefit
Want.
from it. What we need to make sure is those patients who don't want it don't get it.
You know
But
what
they
we
do.
need?
Can
And
I ask
they
you
do.
a
just turn to
question
your
a minute?
point,
Do
if I can just
say
turn
that.
to your point, that I completely agree that all of the adverse effects ought to be made available. And it doesn't need to be through NICE guidance, which is only ever updated periodically anyway. That
You should
when we
make them
speak
put it
about
in their
ECT,
leaflet.
the information should be available to patients.
They should
But
say
al-
that, but they should put it in the leaflet.
Can I
Also,
ask
when you
you
say
a
that's
question?
forced.
If
You
it's
can
so
be forced.
effective, how come people have to keep having it done time and time again? Whereas, in fact, the more they have it, the more likely they are to get damage.
Yeah.
And in Australia, there was a case of one guy, young guy, whose life then was destroyed. He didn't actually have depression. He was diagnosed as having psychosis. He had ECT over 100 times
Yeah.
even.
Yeah.
And the more they did it, the worse things got. And if any medical establishment, someone who represents, and again, remember, like medicine is supposed to be, according to the Hippocratic Oath, of first do no harm.
First do no
Any medical establishment that agrees to something that can harm surely are going against the very thing they're supposed to represent. It is said all around the world that some people, most people that are given ECT end up harmed. And even ones that suddenly think, oh, they feel better, is because they've got brain damage and they get this temporary sort of euphoria that wears off. Oh, and all of a sudden these wonderful psychiatrists come along, oh, you better have another one. Because it is not a cure. It just can bring about a temporary change in someone's emotional and cognitive state, and then that wears off and they get given it again. What is effective about that? If someone ends up being given it 90 odd times, is it working?
It's short-term relief, isn't it? Short-term relief with
I mean,
long-term devastating.
doctors would say
And
that.
about consent, can I just say, when you say consent,
I think what I've got from you is pretty clear. Excuse me. It's a pretty clear sense that you, for perfectly reasonable reasons, would prefer the procedures not available. I understand that,
Definitely.
and from your personal experience, and from the
Many
information that you've
others.
got available, I quite understand why you take that position.
Thank you.
I get your position. I do understand that. But we have to take a view which is based on the evidence that's available to us. And we have to take a view that, as far as we can, balances the risks, the benefits and the harms of all sorts of things. It's not just ECT that has risks, all sorts of things, all kind of medicines, all sorts of procedures, all sorts of surgery does. The whole issue of the use
Mesh.
of mesh. You're absolutely.
And NICE have actually allowed people to carry
Well,
on doing it, which is wrong.
Questions around it, and it would be absolutely essential prerequisite that there's consent. And if in all the examples,
No, but you do
if
get
in all the
forced to have it.
examples, if
Some
in all
people
the
are
examples,
forced.
you're-
under
Yeah,
Mental
they just
Health
gotta say
Act,
Some people
with
are
respect,
forced
if in all
to
the
have it.
examples you're giving me, the issue is about consent, then
Free
it's
and
not
informed
to
consent.
Do,
Not just
it's not to do
consent.
with the guidance that NICE produces. That's to do with the interaction between the individual patient and the physician's concerned. And it's absolutely essential that appropriate consent.
NICE
Well,
guidelines,
no, but your guidelines say that
combined
people
with
can have
Mental
it.
Health Act have power. They give unlimited power to psychiatrists who do not care. The psychiatrists are taking care of my son. When I question about the quality of life, he said it's not his concern.
Spoken to about that?
I have spoken. I've been advocating for my son for years. I've been writing complaints. I've been writing about my son's health problems. You know, he's been
What
experiencing.
answers do you get from the
And-
clinicians who are caring for?
They've destroyed him. They have
They
destroyed
do
him. They
not
just up the drugs.
recognize
Yeah,
the
the worse
consequence.
people
They
get,
do, no,
the
no,
more
they
drugs
do
they're
not.
given.
They do not. They are not willing to discuss any of my son's health issues, of the complications. They are not recognizing that these are the consequences of the treatment he's given. They ignore. They brush away. They do not want, when there's no opportunity, not at the meetings. They do not. They are. They
Organ damage.
They get out of their. They do not recognize, don't take any responsibility, nothing to do with their treatments. That's what. And
they're
by
in
the way,
denial.
when questioning, when I insist on, and they would say, we follow NICE guidelines. Let me tell you this. You are the part of their decision making. Whatever is happening is very much influencing and giving them right to continue what they're doing. We need totally to revise the health services, the healthcare need to be about prevention. Why do we need to look into what leads people into the conditions where then they're given the ECTs, the harmful, destroying their life treatment. This is what we need. This is what the healthcare needs to be about. Let's think of alternatives.
That people
I
are
don't disagree
ill.
with the need for.
Well, let's put first. Let's give priority to alternatives. Let's do something
I think we have to be very
harmless.
careful of taking away the opportunity.
How
for
can
this.
you
I'm
say
sorry, but
that
if you
giving
don't give
someone
any
brain
choice,
damage
and we need
is
to understand.
helpful?
You're saying the mental health system. It doesn't only comprise of that, but they work together. And very much either is NICE guidelines or Mental Health Act. So we do not have any room out of this. People, once there's sections, Section 3, and many of them are sectioned. Once they get diagnosed, we need to look into diagnostics. Are we looking to actually? There's a fact, known fact. Many symptoms, psychological symptoms, they've got root causes. The mental illness. There are many parts of. Once is psychological. It depends on what happens to person in life in terms of the social side of that. Another, the physical. We do not have right now in NHS proper diagnostic to determine the root causes. It's now with thousands of conditions, physical health condition, which manifest, which show the have symptoms of mental illnesses. Do we have those diagnostics? Do we have those tests? No, we don't. All we are told, if any person, distressed person, experiences those symptoms, and any of us can, due to social inequalities, due to many reasons, may experience those symptoms. So
And
what we have
psychiatry is all about symptom control.
Symptoms.
It's not actually therapeutic, and it
Not at
doesn't
all.
actually help. None of the treatments, including ECT, are a cure or actually take away these so-called symptoms on a permanent basis. Why is it that everyone that's given ECT and medication, end up on it for years? And this is what you approve of.
I think
It's not therapeutic.
I do have a great sympathy with any patient who's been harmed by any procedure, whether it's ECT or whether it's drug procedures. I entirely respect the experiences that you've had and the passion with which you feel wrong decisions have been taken and the cases that you've been talking about. But our responsibility is to make sure that we produce advice based on the evidence that's available to us, to make sure that where issues of consent or where issues associated with adverse procedures are clear, we set that out in the guidance. We make it clear that that represents the basis of our advice. But individual treatment decisions are a matter for individual patients.
Well, patients don't really have a say
And the
in
clinicians
it.
who care for them. And there's not much more I can do, I'm afraid, than simply
You
to
could
make
put more
that
in the
clear. I
guidance.
can't-
It could be more clear in the guidance that they've got to put on their ECT leaflets, brain damage, for example,
when we're consulting on
stuff like that.
when we're consulting on guidance where that's relevant, you're
But I
very
wonder
free
where
to,
you get your facts
to make your
from.
comments
Yeah,
on that.
I mean,
So
do you
tell
think
us what you think.
you could have NSUN come on the board or
Sorry?
something? NSUN, if you could have NSUN, that's the National Survivor User Network. You know,
Well,
they were on
because-
the Mental Health Act
They-
review.
But if they want, they can comment on the guidance as well. They're free to do that. Any organisation.
But would that lead? We comment. Okay, people will come and comment. By the way, when you say patients and service users, most of them, you don't hear from most of them. You don't hear many people talking. The reason why? Because they are disabled by
Yeah.
the ECTs
Yeah,
or
they're silent.
over medication. This is ongoing. It's tragedy. It is a scandal, honestly, what's going on.
is.
Well,
So
that's
you
why-
see us,
Long-term
who are
disabled.
families, family members or whoever
By
activists.
the drugs.
You see us, very few.
Why I
But
have,
but
I have
what?
enough respect for how you feel, what you say to come.
But we would like to know what is the way? Is there any way of, we could, we could kind of sit together, maybe the NSUN or whoever, the representatives from the service users, and communicate, talk, and see what are the alternatives. What is the way? You're saying we comment. What would that? Where would that lead to?
Because that's the only way in which we can ensure that everybody has the opportunity to say what they want. The
Yeah.
consultation is a genuine consultation. It provides an opportunity for people who are concerned about what we say when we're in the process of updating our guidance or publishing new guidance.
Okay,
It allows everybody the
when is the
opportunity.
next one? So we keep
Yes,
an eye.
next is 2020.
Okay.
This guy, right, he's a psychiatrist in, without the bananas, he's a psychiatrist in Ireland, and he was asked to speak at the Moorsley debate on ECT. And he is actually paid by Mecta, which is an ACT machine manufacturer, to talk for them. And he actually said here, you can see it on the internet, so the actual amount of energy is really small. It's 1/10,000th of the amount of energy in a banana. He's talking about ECT. That's how little energy goes into the brain. I mean, that is just like a complete lie.
And if you listen to something
You know,
like
and the
that,
psychiatrists do say, they go, it's safe and effective. That's their little sentence, and it's not safe.
but it's still,
He is responsible for what he says. I'm not. NICE is not responsible for the observations of individual psychiatrists again.
Yeah, but they're all like that, aren't they?
I absolutely.
But that's why
understand
your
you-
guidance should be like really strong.
The guidance is clear in our view about the need for consent and about adverse effects, about the clinical circumstances in which it's appropriate to use the procedure. Its application in practice in individual cases has to be the responsibility of individual
Because
clinicians.
people are
who need to
afraid. People are
take
afraid on the
responsibility.
wards. They are afraid. I mean, it's not good to be afraid on the ward, thinking that you might get it next. They see people coming back from it who are completely done. You can't even remember their name, and people are on the wards. They are frightened, and I mean that's not conducive to
Can I just ask you
Yeah.
if you
recovery.
think that quote is actually accurate? What would you say?
I'm not in a position to comment. Nor do I wish to comment on
Exactly what he said.
It's not. It's just for me to express a view on psychiatrists. who've got
Surely,
nothing to
actually,
do
in a
with
way,
the role of
anybody
advanced guidance.
would think having given an electric shock to the brain is not therapeutic.
Most people would say it's a bad idea. If you think about it,
About his case,
to get a fit.
I do actually want to hear, if you don't mind, just saying how. I want you first to explain to us why you believe, first of all, in that ECT is a cure. If you do believe that, do you believe ECT is a cure for mental ill health?
I think it's a treatment that has its place in specific clinical conditions. So, in a way that we recommend in our guidance, yes.
So you're
No,
saying
no,
yes.
not necessarily a cure.
So you don't think it's a cure?
But in conditions like depression, for example, cure itself is a concept which